Closed captioning, sure we activate that. I don't know if it's already active. I turned it on my screen, so hopefully that's
Let me show captions. Okay, let me do it.
Thank you, Carrie.
All righty.
Great. I'm excited to be here. Again, as Carrie mentioned, I'm Michael Andrade. I'm the president and CEO of the ARC of Bristol County. I've been working here for, believe it or not, almost 20 years. I've gotten to know so many individuals. And for those of you who I don't know, welcome. Nice to meet you and thanks for joining. I'm hoping that today we're going to cover a lot of different information and that you all walk away with at least one piece of new information. Because every time I look at this, I tend to kind of see yet another lens, a different perspective, and hopefully you find this information helpful. I do have a PowerPoint that we then can send out as follow-up. But before I jump into the PowerPoint, I'm going to flip things around a little bit. I know some folks have actually submitted some questions, so I'm actually going to answer those questions ahead of time so that people, if they only came for that particular question, you don't need to stay for the full hour. Hopefully you get that piece of information, and though you're welcome to stay for the rest of it, I want to make sure that people understand kind of what I'll be doing for the next 45 minutes. So one of the first questions that came in was this notion of RevPay authorization for ABLE accounts. So Social Security Administration does acknowledge that RevPayees do have the authority towards opening up ABLE accounts. One of the other questions that came in, what are the changes and what to do? So what I'm talking about today isn't necessarily fundamental policy changes. What I'm talking about is making sure that people are aware of strategies towards ensuring public benefits. So if you thought this was going to be around mass health, detailed programmatic changes, that's not what I'm going to talk about. I'm going to talk about making sure that how do folks make sure they preserve their benefits and what are some key tools towards ensuring that that happens, especially in the wake of the pandemic and some things that have occurred that may be placing them in jeopardy. So I'm going to be talking about some key tools and vehicles towards making sure that people can preserve those benefits. One of the other questions is, will this affect or cause any delays with premium assistance payments at all? So if you're in compliance and the asset limits are in effect and you've done your renewals, there shouldn't be any interruption. So I'm going to be talking about some of those components. One other person asked around understanding the difference between ABLE accounts and special needs trusts, and I will be covering that. Actually, that's pretty much the bulk of this presentation is kind of going into the nuances of each. And at the end, I'll talk about a comparison chart that I've developed to help guide you through. One person asked in terms of what are the pros and cons of the ABLE accounts, how to best set it up, and what are the beneficiary approaches. I'll talk about that when I get into the specifics of the ABLE account. We'll review high level. And then what I envision is that if there's interest in more subsequent trainings that have specific content, we will work through that. And we can then schedule a follow-up and subsequent trainings that will help kind of address key questions that people have if they feel that we need more detail in certain areas. If I open an ABLE account, will I have to file taxes? Currently, I do not have to. No. So the way that the ABLE accounts were designed is that they are not required to pay federal taxes or state taxes on both the disbursements as well as income that they generate. That's a little different than trusts, and I'll explain that as we get into the presentation. This person has an SNT, and I'm worried about how to manage the yearly interest. So with the special needs trust, simply the yearly interest that you achieve, you earn, that is taxable income. And traditionally what happens is at that point, you would consult an accountant and be able to then address that interest in terms of earnings and what is required for tax purposes. If you're concerned about the amount of interest that it's yielding, then a simple solution would be to look to convert that to a money market account so that it's not yielding as much interest and placing a requirement that you then would have to file taxes. So some of these pieces that I would encourage people to consult with their tax.
Hello.
Towards
Congratulations.
All right. Another question was around, can you work and get SSI? Absolutely. That has not changed. The limit has gone up to $85. So the person can make their first $85 without kind of any impact on their public benefits. And then after that, it's a dollar for dollar average. So that $1 the person makes Social Security then counts that other dollar, and then they would adjust their SSI payment to the point where once they achieve the threshold, the income limit, then what would happen is then they wouldn't be eligible for SSI. In terms of public benefits, some people asked around, do they need to reapply? And the answer is depending on the public benefit. So for SSI, you don't need to reapply. What happens is they go in and they look at yearly verification in terms of assets. And if they find that people are over assets, then at that point they would adjust the income. If the assets have adjusted and become lower, then they also could raise the income. Same would apply for other public benefits like mass health. We renewed every year despite the emergency. How's it going to be different than any other year? Nothing is going to change. The process should be the same. The key thing that's happening now is that redeterminations through mass health have been suspended during the public emergency. They're resuming again. So as whatever you've always done, be prepared, you're going to be doing it again. So for the past couple of years, you may have had a reprieve because of the public health emergency. That is going to be reinstated. So they're going to start that process again. So it's important that now is the time that we look at certain assets to make sure that we take advantage of these different tools so that by come April 1st, there are no concerns with assets towards causing any kind of disruption or disqualification of benefits. Advice for staff working in agencies with adults both under guardianship or who are their own guardians. So again, agencies assisting people looking at their assets. And if there's more than $2,000 in people's bank accounts, part of that is.
I might hand the phone to you for that, okay?
And if you don't mind muting. So part of that is, again, working with guardians, working with individuals now and having those kind of conversations to then make sure that people are below assets so that we don't get to April or May and then find out that people are in over asset. And then at that point, the redetermination may have occurred and would have an adverse effect on their benefits. So part of that is from now until that April 1st period, you have some time to kind of walk through some of the tools I'm going to talk with you about and explore some of these tools to make sure that we can help support people around those. Trust asset limits, I'll be covering that as part of the presentation. Asset limit to be eligible for mass health. Traditionally, it's about $2,000. It can vary based on certain experiences. Things like a car and a house, those things don't count. They're looking at liquid assets in the bank or access to a whole life insurance policy. So there's certain things that we want to be mindful of that can get calculated into asset. But the general rule of thumb is we tend to recommend no more than $2,000 because that's the SSI threshold. That's also the mass health threshold. If folks are married, that threshold drops down from instead of $2,000 and $2,000 because they're a couple and they're married. It's actually $3,000. That's the cap. Creating an ABLE account through Stable, Ohio. I'll be talking about that. What does it mean for my 62-year-old sister on mass health and Medicare? So Medicare is an entitlement program that is not means tested. So we're not worried about Medicare. This is focusing on Medicaid, which is means tested. So we'll be talking about the ways, again, to get those assets legally under the $2,000 threshold. How does someone access the money in their ABLE account and how fast is that access? I'll cover that. And part of what I want to learn more about the ABLE accounts. These are all the things I'm going to be covering with the next of our time together. So if there's more questions, I won't be looking at the chat right now. I'm going to have Carrie afterwards. We'll leave some time at the end to make sure we have time to address questions, but I'm going to jump right in and share the screen. This way we can kind of begin going through different pieces. Can you guys all see that? Carrie, just give me a head nod. All right, awesome. All right. So again, basically what I'm going to be looking at are the investment tools. What are the different options you have to ensure that people can maximize their supplemental needs? Everything that I'm talking about today are all legal tools that have been established both here in Massachusetts and also at the federal level towards ensuring that people have options towards being able to utilize their funds and putting them in a different type of account where it does not adversely impact their benefit, but still allow some level of supplemental needs support. So the idea here, so when we thought about the creation of trusts in the 1990s and in the 2014, when the ABLE Act was passed at the federal level, the idea here was to ensure that we could create these tools towards making sure that we can empower individuals towards having access to supplemental needs funding to provide a better quality of life. They acknowledged that the asset limits were very rigid. And in fact, the SSI asset limit hasn't been adjusted for inflation since 1989. So that $2,000 has been in effect since 1989. So they have not changed the limit, but they've at least changed the way we could look at putting tools in place towards helping support people. And that's what I'll be talking a little bit about today. As to why in 2023, why is this of a concern right now? Well, a couple of things that have happened. With pandemic, a lot of people have built savings because people weren't going out. They weren't doing the things that they were doing. So many of them just have accumulated savings that have just developed over time. Again, redeterminations didn't occur, so they didn't have any adverse impact if they had $3,000 or $4,000 sitting in their account. Now that's going to be a problem because come April 1st, when they start doing the revalidation, if those funds aren't addressed, then at that point it could affect their benefits. Some folks have stimulus payments. So we know that we all received some level of stimulus payment during the pandemic. Were those funds used? So Social Security basically put in, they didn't have a penalty to allow folks to use those funds. So it didn't affect their assets. But for Medicaid purposes, if those funds are still sitting in their account for redetermination purposes, it will adversely impact their benefits. So again, when we think about the types of dollars that may be sitting in accounts that people haven't thought about, part of that is making sure that they're making some adjustments and being able to kind of walk through some of the steps if they're in those situations. Work earnings. So great news about minimum wage going up and all these wonderful kind of incentives and the market going up and people being able to make more money. If they're getting a higher rate, then that means they may be having more money in their bank account. So how do we make sure that those bank accounts are brought back down under thresholds so as not to adversely hurt them? One of the big things that happened was, come January 1st, we saw the largest Social Security increase in quite a long time, an 8.7% increase in Social Security. So again, that's to address inflation. But if folks have capitated rent and they're not adjusting for those expenses, then they may have more savings. It's a great thing on one level, so people have more money in their banking account. The bad news is that if we don't do something with that extra money, then that could adversely affect them. So again, as we look at the revalidation process, we want to begin thinking about, all right, how do you get people back to the $2,000? How do we look to see what we can do? And there's 3 different approaches. And the first approach you may find silly, but the reality is the first thing I always tell families is spend it. Are there different needs? Are there things that person can benefit from? Are there clothes? Are there furniture things? Are there electronic things that they're interested in? Games? What are things that are important to that person? And what are things that they could purchase? One of the big areas that I always recommend is that, I have people put together plans for funeral costs and looking at, other future interest issues and making sure that they can put those funds in those kind of long-term investments so those matters are addressed. But many folks don't even think about spending it. They go right to the tool options. But I always remind people the first place is, okay, is there something that person would like, needs, that you can use those funds? That's what they're intended for. They're discretionary funds to be able to support them. So is there something out there that we haven't thought of because that wasn't the mentality that people were looking at? But that's always the first question because that's easy. You identify what it is, you buy it, and then the funds are below asset. The one thing that we just be careful here is that if you buy anything that has an asset value, so for example, Some folks may be interested in life insurance. If you do any kind of life insurance tools that have what's called whole life that actually have a cash value, that does get calculated into the asset management piece. So my recommendation is to stay away from those kind of products. Term life is allowed and it doesn't disqualify, because again, what Mass Health and SSI is looking at is what does that person own? And if anything has a cash value, again, with the exceptions of a house, an automobile, then that then gets calculated into their benefit. And we want to make sure we maximize the benefit for all individuals that they're entitled to. So again, what are the things that they can buy? Just stay away from anything that then has a cash value. So don't go and buy bonds or anything that then is actually going to yield a cash value. The rule of thumb here is what are things that they can have that they need that will help support them and bring their accounts below the $2,000 threshold. When we get into, okay, you've thought about everything, there's nothing, at this point, then we start looking at these other tools. We're going to talk a little bit about ABLE and the benefits of it, what are the nuances of it, what are the limitations, and then we're going to end with trusts and just kind of understanding the different types. And again, I'll walk through a comparison chart so that people can kind of have a Cliff Note version of what I'm going to talk about today. So we're going to jump right in and talk about, again, this is just simply reminding everybody why it's important, all the basis, but ABLE accounts. So ABLE, Achieving a Better Life Experience Act. That's what that's for. And what happened here is the ARC of the United States and the disability community had advocated for this federal legislation towards empowering people so as not to them continue to have these kind of issues with asset loss. I'm sorry, with benefit loss. So Congress passed through the IRS regulation. So it's important to understand that because this is where the ABLE accounts sits. There's a process called, for those of you who are familiar with college savings plans, it's 529 account. They basically mirrored that to create a 529A, and that's where the ABLE Act regulation sits and is governed by the IRS. So the IRS actually has key language around how these funds are managed and how they will be interpreted. And then they work in concert with Medicaid and Social Security to ensure that people understand kind of the cross impact of the regulation. But at a very high level, one of the first things to know is that to be eligible for an ABLE account, the onset of disability needs to occur before the age of 26. So that's important in the sense that if someone suffers from an acquired brain injury and that happened at the age of 27, they would not be eligible for an ABLE account at this time. When in the work that we do here at the ARC, many folks do qualify, but we always look at that standard because that is a required standard and all ABLE vendors will ask that question. Good news is we did pass new legislation that starting in 2026, the age will be increased to 46. So we are slowly at the federal level working to enhance and improve not only this act, but lots of other programs. But as of right now, the age is 26 in terms of the onset of disability. So again, not to be confused, a person could be 55 years old and apply for the ABLE account so long as the onset of disability occurred before the age of 26. The other piece to know is that right now the ABLE account has an annual limit contribution, and that annual limit is $17,000. So again, as we look at people's accounts, and if they have more than $17,000 that they need to spend, then only $17,000 go ABLE on an annual basis. That is the max. Collectively, it's up to $100,000 that SSI and Mass Health will disqualify. Anything over that, then it does count as an asset. So important distinctions to understand. In one of the key words that you'll see with the ABLE account is this notion of disqualified disability expense. And the way that both the IRS, Social Security, and Medicaid defined it, they left it very open and vague in the purpose of supporting education, food, housing, transportation, financial management, administrative, legal costs. They created a very vague interpretation of the options, and they did that by design to allow lots of flexibility. One key distinction between the ABLE account and a trust is that ABLE accounts are allowed to pay for food and housing. Trusts limit food and housing payments because Social Security interprets those payments as an asset. So for example, if somebody needed assistance with their rent and a trust gave them $200 a month towards supporting their rent, Social Security would see that $200 as income, because technically Social Security says we give you SSI, and that's supposed to be for your board and care. So part of that, they argue that part of that calculation is giving so much for their rent. So if they get any additional subsequent money from a trust, that's counted as income. The ABLE account does not treat it the same way. So Social Security, when they again define this language, they allowed for folks to be able to have assistance with housing so as to not be countable as assets. So that's, again, a key distinction so that people understand. Traditionally in the trust world, food and housing are no, but in the ABLE world, that is allowed. In Massachusetts, so every state has their own ABLE program. In Massachusetts, so the way that this happened is once the federal legislation passed, every state then worked with their respective state partners, and then they worked with contractors. So here in Massachusetts, MIFA, which is the Massachusetts Educational Finance Authority, decided to contract with Fidelity. And Fidelity Investments then created what they call the Attainable Savings Plan. Very similar in design across other ABLE accounts throughout the states. Some specific aspects of the Attainable Savings Plan here in Massachusetts. And again, very similar to other ABLE programs across other states. The idea of this notion of supporting independence and trying to build quality of life. So unlike trust programs or other kind of programs where they're really involved in providing what I call cash and counseling, they're not doing any counseling. So Fidelity, simply think of a bank. You put the money in, and then when you need it, you access those funds. And there's a couple of ways to access those funds. You can ask them for a check directly to the vendor, or many of them also have access to a prepaid debit card. And then they would issue that debit card to the individual towards purchasing those necessary purchases. They're not there to approve nor deny. The expectation is that the individual is responsible for whatever it is they're asking for. So just like a college saving plan, for those of you who are familiar with that, the financial firm does not verify that you use those funds for college tuition. You certify and you attest that those funds were used for that purpose. That is the way the ABLE account works. They expect the person to ensure that they understand the definition of disability-related expense and that it's supporting their needs. And the IRS will hold that person accountable. So again, what does that mean? That means they shouldn't be taking out money to give it to other people. The idea here is it's supposed to be for their sole benefit. They shouldn't be doing things that are going to potentially, create harm to themselves. So part of that is making sure we're supporting people around that, but the Attainable program won't help with that. That's where then the ARC and other support organizations come in and help support people. One of the key things about both the ABLE funds and the pool trust funds, all trust funds, in most cases, is that funds are typically invested. And what happens is most ABLE programs will give options. Do you want a moderate investment strategy? Do you want a more money market approach? There's a whole range of different options that many of them will give you. But the idea here is to be able to take these funds, put them aside. This way, they're not going to hurt folks with their assets, and then grow them. So the idea is that they'll be invested at a level of comfort that each person is comfortable with, so that eventually they can then access not only what they put in, but then have a modest gain. The ABLE accounts are not subject to federal and state taxes. And that's a key distinction between trusts, because trust earned income is, but in the ABLE account, so assuming you put in $1,000 and that account grows to $5,000, that growth is not subject to tax. Neither are any disbursements that come out. So if the person asks for money, those items aren't taxable. And I just realized this amount should have been 17,000. A little typo. I'll fix that, Carrie, before I send it out. But again, the cap right now is $17,000 that they can go. That just gives you the example of, we started the ABLE account with 14,000, and every year it's been getting adjusted. Our hope at some point is that there won't be a limit, but we will continue from an advocacy standpoint towards addressing that. And as I referenced before, the way people can access those funds is that they'd be going back to the ABLE entity. So here, Attainable. Typically, Attainable takes about 5 to 7 business days. So from there, if they're putting in a check request, they would do it electronically, 5 to 7 business days to then have the check issued. If they're sending it by mail, then they would have to add in an additional week for mail processing. Or if they access for a debit card, then the debit card would have a certain amount, and then they would ask for replenishment with whatever process they wanted. So let's say they want to start off with $500. And then once it gets close to the end of the $500, they can ask for a recharge of $500. But those are all the kind of options that the Attainable program affords. How do you get into it? So it's a simple process. They want you to do, it's not going to their office. It's just doing everything online or calling them, and they'll walk people through. They will require attestations around disability. So the person, in terms of, they're not requiring documents around disability determination. They're asking for certain questions, but it typically takes 10 to 15 minutes to open up an account. If you are the Payee, the Attainable program here in Massachusetts requires a phone call, because they will want to see an award letter that will accompany that. And if you are a guardian, they will require the guardianship decree. The beauty about the ABLE account, it can be opened by the individual, it can be opened by a parent, guardian, and or a Payee supporting that individual. It is their account. So it's opened by all those other partners, but at the end of the day, it is that if it's Michael Andrade and you're opening on my behalf, it's my account, you're going to help me with it, but those are my funds. And part of that is supporting me around making my choices about what I'd like to buy. So again, the process is fairly simple towards opening one up. The concern is around that support side. They're not going to advise people around mass health and public benefits. That's not what the ABLE accounts were designed to do. They were designed to be a vehicle, not necessarily providing the support around it. As I mentioned before, I'm just one other key distinction I haven't talked about is that for folks who are working. So for folks who are working, they have an actually additional contribution limit. So they can actually add an additional $13,590. That's the current level as this year. So in addition to the 17,000, they can go up and be able to contribute earned income. So if someone's struggling, if they're making too much money because they got a raise or they started working extra hours, they can take that excess money and they can put it into the ABLE account, and it won't affect their assets. How far or how big can an account grow? Most ABLE accounts have a cap of about $500,000 that they'll let the accounts grow to. But remember, those accounts are only up to $100,000 right now is what SSI and Medicaid say that they will allow, they won't count as assets. So people can grow their accounts further, but at that point, after $100,000, it will impact their assets. The other program I just wanted to share a little bit about, because people have asked me about it. Again, I've covered a lot of these, and I'll make sure that you all get the PowerPoint. But is this company called Stable, and we've been using Stable now for a little bit towards establishing SubAccounts. So we are corporate Payee. So many nonprofit organizations are actually corporate entities, and they wanted to make sure that they could open up sub-accounts on behalf of beneficiaries. Massachusetts in the Attainable program will not acknowledge an entity as a rep payee. So for example, they will acknowledge Michael Andrade if I serve as a rep payee, but if they won't acknowledge the ARC of Bristol County because they didn't design an entity, established relationship. Stable out of Ohio will and has. They have a process to establish an authorized legal entity as a manager. And then that allows corporate rep payees towards going in and opening sub-accounts and then supporting people with those funds. All the same rules apply. And again, we recommend people to look at a moderate income growth strategy. That is what when we look at the Centers for Philanthropy across the country and the world, that is something that we've been approaching and working around investment policies towards allowing for some growth, but also a moderate growth so that we don't have people in high risk categories. However, if it's an individual's choice, then they get to choose as to what's the comfort level for investment strategy makes most sense for them. And again, I just included the website this way people, again, very simple process. Organizations will be able to go forward and establish those accounts and move forward similar to how I've described it. Takes about 10 to 15 minutes to complete the applications and then supporting people with those sub accounts. Again, when you think about using the ABLE accounts, there's no requirement to go to court. So that is a big advantage. Whereas in trusts, I'll talk about in a few minutes, that requires, especially if people have a legal guardian, that will require what's called an expansion of powers. So for the ABLE account, no expansion of powers are necessary. People can go ahead and apply with their current guardianship decree. The other big piece around kind of some of the key differences with the ABLE accounts and the trusts is that support. So the ABLE groups don't do that support. Trusts are still legally responsible to provide the oversight and ensuring the compliance, where in the ABLE accounts, basically what the IRS is saying is we will hold the person with a disability and their support system responsible to ensure that they meet the definition of disability related expenses. Now, how they're going to do that, we don't know because it's still new. And when we've asked the question in terms of audits or any kind of questions, they simply have said that they expect that people will track whatever expenses that they're putting in towards the ABLE and simply ensure that they're available should they ever be audited. So we're hopeful that that's not going to be a problem. But some key differences in terms of understanding that, again, from an empowerment model, that's what the ABLE was designed to do. But on the flip side, if people are more comfortable with kind of ensuring that there's an entity kind of managing all the various aspects and compliance, that's where then we get into the trust world. I'm going to go pretty quickly through the trust piece so that people can just understand, because I want to spend a little bit of time really concentrating on the differences and kind of walking you through, the different options between each one. So again, the history of special needs trusts, they were established in 1993 through the OBRA, so the Omnibus Reconciliation Act. And part of that was really looking at how we kind of establish different tools towards supporting people for the very things we've been talking about today. There's different types. I'm going to just kind of go through some key things we look at. In terms of age is a big factor for trusts, because in the event that someone is over 65, the only option they have at that point is what's called a pool trust. In Massachusetts, Medicaid governs how we look at the trust. So each state does have authority as to how they look at trust income and trust assets. Currently in Massachusetts, there is a regulation that will be taking effect on June 1st. That will disqualify certain seniors who don't identify as having a lifelong disability. So we're working on some advocacy there, but in its current design, everything is still in effect so that folks can apply for the different trust options. But right now, again, as we think of certain folks, once they hit 65, the pool trust is the only option because a supplemental needs trust is not allowed after that age. Some key elements, sole benefit. So similar to what I shared about ABLE, the idea here is this isn't to support other people. You know, what we have here is that this is to allow folks to be able to access these funds for their benefit. And similar, so the ABLE accounts and the pool trust, and I haven't shared this yet, one key piece to understand around an important piece is that there is what's called a Medicaid payback. So both for ABLE and for pool trusts, Medicaid says, we're going to not count this money towards your assets while you're alive. But then upon your death, we reserve the right to submit a claim. And whatever's left in your account, if it's less than what your claim is, then you need to give us what's in the account. If it's more than what the claim is, then at that point, you can then release additional funds to your beneficiaries. So that's an important piece because what basically Medicaid is saying is that we're not going to count this money while you're alive, but then upon your death, we are going to reserve the right that we're going to put a claim and we're going to capture some of that money back if you haven't used it. If there's money left over, great, people can then identify beneficiaries. So that is a key distinction. And I'll talk about a type of trust that doesn't have that level of payback in a minute. Another key area around special needs trusts, they are irrevocable. Once you establish them, you can't take them out. ABLE accounts, once you establish them, if you change your mind, you can take those funds out, but the minute you take them out, then they're now counted as assets. So again, understanding the different pieces. Another key distinction, ABLE account, the control typically rests with the person or a representative that they've identified. With the trust, the control falls with the trustee. And the notion of the trustee is they're responsible to ensure that all of the requirements are met so that those funds aren't put in any kind of danger. Again, I'm going to kind of move through. We have a special a pool trust here at the ARC, so I'm just kind of share some highlights of it, just because then people will get a sense of what this is. There's other pool trusts in Massachusetts, but I'll use ours just kind of as the example. As I talked before, part of the limits, we stick with the $2,000. We try to ensure that we're monitoring and supporting people around those different approaches. When you hear the word pool trust, people kind of get nervous thinking they're pooled, their funds are pooled, and their dollars get kind of put in a big bag. That doesn't happen. People actually have their accounts and we manage. When you reference the word pooled, pool comes from two different approaches. One is instead of everyone having their own unique trust, we have what's called a master joinder agreement that brings everyone under one large trust. They still have all their specific information, but the rules all comply and they're consistent across the board. They provide all of the benefits that all the trusts would provide. There are some nuances from an individual trust. And then the other basis for pooled is the funds are pooled in the sense of investment purposes. So when we go to the bank, we say collectively, we represent $25 million in people's individuals' money. So for purpose of investment, we have a dedicated investment manager. We can yield certain rates that if that person went with a $10,000 account, it would be very different in that experience in terms of having a dedicated account manager. Again, I'm going to go through some of this because I want to make sure I have time for all the other pieces. So again, individual pool trusts. So these are the kinds that, so Michael Andrade, I have a disability, the funds are in my bank account. As we started this conversation, I need to make sure that those funds come out. They can move forward with an individual pool trust where those dollars are going. There will be a Medicaid payback provision. And then from there, I can access those funds for my sole benefit and for my supplemental needs. The other tool we have is what's called a third-party trust. And a third-party trust is where a family member says, I want to put money aside for Michael, because what we all know is we don't want to leave an inheritance to Michael because he's on public benefits. So what a family can do is create a third-party pool trust where they say this is going to be for Michael's supplemental needs. and then fund that trust. Because the money never went in my possession, that's why we call it a third party. It's a third party related transaction. Then 100% of those funds remain in the trust. And upon my death, those funds would go to my beneficiary. Mass Health doesn't have a payback clause because those funds were never mine. So part of that is something not illegal, not what's called a payback trust. And again, can be part of a life insurance policy or an estate plan. So I've talked earlier about whole life. So if my father had a whole life policy that then left that asset to create this trust, that's perfectly allowed because it's a third party transaction. Just some rules around the different trusts is beneficiaries can never receive cash. Part of that is, and why some of the nonprofit organizations manage the different trusts is we try to kind of manage and be mindful of costs and making sure that we're supporting and maximizing people's public benefits. We were working to make sure that we're always aware of variety of laws and regulations with Mass Health. As I mentioned, there's some changes happening with Mass Health, and we're doing some advocacy around that and making sure that we're supporting people towards their needs. Because part of why we do this is to ensure that if they're in a nursing home for whatever reason and they need additional supports, that families have peace of mind that there's an organization that's going to help them. Or if that person is struggling and needs an emergency shelter and needs us to assist, those are the kind of things that we can. We had a person recently relocate to Texas and was stranded, and we were able to access the funds in his trust to get him back home and then help him get back on his feet here at home. So again, I'm not going to get into the details of the trust process this will be, but basically it's a simpler process where a regular S&T would require a dedicated trust document where an attorney would then develop a more personalized approach. The key difference between a pool trust and a private S&T is that many times an S&T would then identify what's called a trust advisor, which is simply someone that's counseling the trustee on what to do, or a trust protector, which would then prohibit the trustee from releasing any funds without their approval. There's lots of other small little things, but at a high level, that really is kind of the main kind of major differences. And also certainly the cost. The pool trust is a lot cheaper. Most of them are between $500 to $700 in Massachusetts to get one established, and versus the cost of $2,000 to $4,000 for a dedicated supplemental needs trust. But I'm going to go to the little comparison chart because this can be your cheat sheet. So again, eligibility. Able, onset of disability has to be before 26. For the pool trust, special needs trust, first party special needs trust or third party special needs trust, there's no age limitation, no age requirement. With the exception of, again, the S&T first party, again, that person's disability, they have to be before the age of 65 before they can establish that. Allowed accounts. ABLE only allows you to have one account. So you can't have multiple. In trust, we can have multiple. So for example, I could have my own trust account. My dad could have a trust account for me. My mother could have a trust account for me. So in the trust world, we can have multiple accounts. In ABLE, you're only allowed one. And remember that one is that $17,000 limit. So the minute you go beyond that limit, they will then reject those funds because they no longer count. Account, in terms of who can open up the account, again, lots of different people can open the account. For ABLE, it's really, it gives so many different options as to who can support that person with opening the account. In the pool trust world, if it's a first party, that means it's the individual who's opening it up or someone acting who has the legal authority for that individual, so a guardian, but that will require an expansion of powers. The probate code here in Massachusetts does not allow guardians to go forward and open up a trust account without special permission. It's not difficult to get. It's what we call a single conservator transaction, and it allows for a trust to be granted. In the event of third party, it's by whoever has the money. So whoever wants to set it up. So whether it's my grandmother, whether it's my father, my parent, my brother, anyone can set it up outside the person. So annual contribution limits, as I mentioned, $17,000 for ABLE as of 2023. For pool trust, special needs trust, for first party and third party, there is no current limit that's been established. In terms of additional contributions, I referenced earlier that in the ABLE account, we have the $13,590 on top of the $17,000 that is allowed for employment income. And as far as pool trust and special needs trusts, many of them allow for additional funds. So many of them don't have any issues with accepting additional contributions, but I always reference that every trust is a little different. So if you're exploring a different trust, you'd want to make sure that there's no concerns. Actually, I do want to go back. So I reference here that no additional funds should be added to a first party special needs trust. So that's in the context that if you have if I'm a first party, so if I'm a person with disability and I've established that special needs trust, you don't want to commingle. You don't want mom and dad or someone else in my family doesn't want to put their money in the trust because of the Medicaid payback provision. They would want to explore a third party trust. Now, if Michael has excess money, so let's say every month because of my employment, I'm making too much money, every month they can contribute to a first party trust. That is not an issue, but you want to make sure that it's not coming from other third party sources because they will be subject to mass health payback, and there are other tools to prevent that from happening. Ongoing management fees. So for ABLE, we typically see most of them, they do vary, but about less than 1% of the funds. So it's based on a percentage, similar to how other investments are made. And as I look at other kind of trust programs, on average, about 2 to 4% of funds that they would charge for yearly management. That includes both the trustee management and also the investment fees. So that's why they're a little bit more because they're doing more. As far as how funds are available to people, again, we're seeing more and more of these debit cards, definitely in the stable accounts. A lot of the trusts are moving in that direction. But at minimum, they would have a check disbursement process. And like, as I said, the fastest I've seen turnaround is about 5 to 7 business days, unless it's an emergency. And I've also seen some cases that it can be up to 14 days. Again, taxes. ABLE does not require to pay taxes, but trusts do. And again, depends on how much money is generated. And then from there, whether or not the tax liability would fall to the individual or the trust would pay that tax liability out of the trust proceeds. So that would be something that folks would then need to consult. But as far as trust will be filing yearly taxes for any funds that were generated, ABLE, you do not have to file any kind of tax statement because they're not subject to tax withholding. And then revocable, as I mentioned, ABLE is revocable. Again, recognizing that you can transfer it similar to the college savings plan. There is a mechanism to allow for transfers among siblings. If funds come out of the ABLE, then what happens is at that point, they are now counted as asset. The trusts, they're not revocable. Once the funds go in, they have to stay for that intended purpose of supplemental needs. And that's why they stay in the provision of not counting as asset. If a person uses all the funds, the trust still exists. It just goes into dormancy phase. And then upon their death, at that point, the trust closes out and then the funds would go back to either Medicaid if it's first party, or if it is for a third party trust, then it would go to their beneficiaries. And I've given you a whole bunch of links to websites and different things. Just so, because I didn't reference the National Academy of Elder Law Attorneys here in Massachusetts, and actually across the country, they are looking at this. They're some key advocates, as well as the ARC of the United States, making sure that we're looking at these policy update areas. I can tell you that this year we advocated that the Social Security asset limits be brought up to $10,000 for single individuals and $20,000 for married couples. That's still in play, but as we know, public policy changes take a long time. But if those things occur, that would make things a lot better for many of the people we support. But we continue working at the national level towards getting some advocacy work in play. And hopefully we'll see some changes over the next few years. But I'll stop talking, and Carrie, walk me through what you want me to answer. You're on mute, Carrie. You're still on mute, Carrie.
I apologize. Thank you for a great presentation, Michael. I'm going to open up the chat. Can money from ABLE or trust go towards vacations for the disabled beneficiary?
Yeah, so both, and so this actually has come up, I've heard it a couple of times. Social Security actually released additional guidance in 2020, where they absolutely enforced that the vacation funds can be used. So there's key elements. One key thing is that certainly the cost for the individual, and they allow for the cost of if the person needs caregiving assistance, then they can use their funds to pay for that one caregiver assistance around their support needs. We also recommend that people would then have that tied to the socialization goals as part of whatever plan of care that they're involved with, towards ensuring that there's documentation that supports that's a disability related expense. So in the event that there was ever an audit from the IRS, they would have a goal that they're working on, and they can absolutely engage those funds. Now, from the trust perspective, trustees will look at it to ensure that it's prudent and that it's realistic. So for example, if the trust only has $5,000 and the person wants to go on a $6,000 vacation, they may encourage them to kind of scale it back a little bit, but absolutely they are allowable.
Great. And what about the person who doesn't have SSI, but receives Social Security from one of the parents, SSDI? So you can still open a trust. Okay.
Yeah, so you can open a trust with it. At that point, you're not so worried about the cutoff of SSDI because there's no asset. They're not looking at income, but Mass Health does. So part of that is now you're going to make sure that you get under asset for Mass Health.
Okay, and then Pat was saying, so if you put the SSI funds into Enable, you can use it for food and housing. Good question. When the father retires, she'll receive a lot more money than she does on SSI.
So again, once whatever excess funds that you have, you can still put it in the ABLE and she can still access the parent SSA. That's perfectly fine. There's no concern there. It's about addressing the current asset limitation now. And remember, the other pieces around, it's not just SSI. You're going to be mindful of Mass Health. So there's lots of programs that maybe a lot of folks aren't on SSI, even those who are working, they may have been disqualified from SSI, but they still need to think about Mass Health because a lot of our programs are still very reliant on Mass Health. So you got to think about both.
Definitely. And I've heard that Mass ABLE is not the most user-friendly. One can open in any state. Any other states may be preferable?
So again, I'm not endorsing it. I've spoken about Mass and I've spoken about Ohio. I've looked at Rhode Island. You know, we're trying to get the National ABLE Center to be more of a resource and engage more in our community. So we have heard that and we want to change that. But as to one that's super, I don't have one right now. I'm still working on that. We're hoping to work with Mass and this stable out of Ohio towards making them better.
Great. And I think you addressed this, but what happens with the ABLE funds when the person passes away?
Mass Health or their Medicaid agency gets first wave. If there's any, they get to put a claim. And then at that point, if there's any remaining money left, then that goes to people's beneficiaries.
Yep. And any estimate of what the Medicaid claim amount would be?
So I can tell you that the largest we've ever had is $575,000 that we had to pay back, and the person had just enough, so that money went back to Mass Health. The smallest we've gotten where, you know, it could be a few $100s. So it depends. What Medicaid basically says is that any funds that they put out, they paid on your behalf, they get to put a claim in. So it depends on how long you've been on Medicaid and what they paid on your behalf.
Okay, and then Pat had a question about, does she has to set up an ABLE account before she reaches a certain age?
Nope. The age requirement is that the onset of disability needs to be 26, but you can be 95 years old and apply for an ABLE. You can be 18-year-old and apply for an ABLE.
Great. So I like the presentation, it's clarity. I think I'm in the one to speak with someone about my particular needs. Are you, can you refer me to someone?
So my email's on the presentation, so we send it out. If folks have questions, send me an email, and I'm happy to then provide those key referrals.
Awesome. And we talked about vacations. It can be used for vacations. And can you go over a rep payee opening up an ABLE account again? If a rep payee is an agency, like an ARC,
Yep.
and they're able to open the account, or is it just the family member that's the rep payee?
So the answer is both. So in Massachusetts, the only answer there is that if there is a rep payee and they are a family rep payee, then they can contact Attainable. There's a number for them to call because they want to walk through the rep payee through the process because there's certain documents they want to see. For corporate rep payees, that's not an option because Massachusetts will not acknowledge a corporate entity. That's why I listed stable. If you're interested in becoming a corporate entity towards supporting people with their ABLE accounts, then stable would be the option. And I'd encourage people to look at what they call the authorized legal entity forms on stable website. They walk you through the entire process of how to be established as a authorized legal entity, and then how to be able to create sub-accounts.
Okay. And then a question that is, if it's not covered, why is the ABLE account a payback?
Because when they initially passed the legislation, we originally didn't want a payback, but Congress said if we're going to then allow this, they added the payback requirement that they wanted those funds back. Because again, when Congress looked at the establishment of this act, part of what they do is they look at what's the fiscal impact of policy. And they originally looked at what we were asking for to cost about $7 billion. As a result, they said, no, we can't do that, but we're going to scale certain things back. And the Medicaid payback provision was basically a measure towards in terms of cost exposure. And they modeled it right similar to the first party trusts.
All right, thanks, Michael. And then Larry's wondering, when did it become allowable for a rep payee to open up an ABLE account?
Actually, rep payees have always been able to do it since the establishment of the ABLE. If you're a corporate rep payee, that's taken a while. We've been trying to advocate for that here in Massachusetts for quite a while. But unfortunately, Fidelity has not moved forward with that approach. So right now, there's two states that do have that approach, and that's the stable program in Ohio, and the only other state that's acknowledging a corporate entity is Illinois.
All righty. And let's see, Michael said, can you please explain more about Medicaid payment claims?
So what happens again, at most simple level, is that if you go to the doctor and Medicaid is getting a bill, they're paying for it. So what happens is that's the claim. They basically say, since we didn't count any of this money that you put into this account, whether it be a stable account or first party trust, upon your death, we're then going to basically put in a claim for what we paid for you. And if there's money left, great, we get it. If there's not enough money left, then we only get what's there. Sometimes there's no money and we don't get anything. So part of the gamble they take is they're saying, we're going to take care of you. We're going to keep paying the bills as if you didn't have that money, because we're going to put it into either an ABLE account or a trust. But upon your death, when you no longer need that money, we want to be able to put a claim. We want to basically say, this is what we paid out on this person's behalf. And if there's money left over, then we want to make ourselves whole. Does that make sense?
Okay, great. And Larry just replied about the rep payee. That wasn't his experience of being able to open an account. So
right, if you look at the Attainable, right on it, it specifies if you're a rep payee, please call, and they will walk you through it.
Okay, great. And one more question. Does an ABLE Act deposit lower the income and amount for Mass Health?
No, so again, they look at the total assets. So what will happen is Mass Health, well, let me reclassify that. Yes, whatever money you put in the ABLE account will not count towards Social Security, nor will it count towards Mass Health. However, if you're looking for an adjustment in terms of your monthly payment, so you say, well, I just gave $10,000 into my, I just gave a couple of $100 towards my ABLE account, so you should readjust my my cost for Medicaid premiums. They may not look at it that way. They may say, no, 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 we're exempting that money, but we're not going to give you the double bang for it.
Alrighty, okay, I think that's pretty much it. So Michael, thank you so much. This was a really, such a great presentation. I know I learned a lot, and you know, it's complicated, but it's also something that just taking the time to understand is so important. So we're just going to fix a little monetary slide in the presentation, then I'll be sending them out to you, PDF, anybody who registered. And I just want to thank everybody for attending today, and especially you, Michael, for taking the time and sharing your knowledge with us. So if you would like any additional information about ABLE or any of the things that we talked about today, just email me. I'm mahoney@arcmass.org, and I'd be happy to arrange it. So again, thanks. Hope everybody has a great day.
Thank you
Bye-bye.
all. Bye-bye.